Institute of Management, is a former civil servant and has been the youngest and longest serving secretary, commissioner, principal commissioner, and director of India's biggest statutory urban body, DDA, Government of India, for 28 years. He has headed several public sector undertakings and was the advisor to the Lieutenant Governor Delhi at the time of Commonwealth Games 2010. He is the chairman of the Education Committee of the PhD Chamber of Commerce and Industry. So over to you, Dr. Bansal.
Thank you so much, Nikhil. And it's a great pleasure and honor hosting such warm friends of NDIM and such warm friends of this country. The relationship started 3 years back with Mr. T.K. Nair, our board director, who's been given the Rising Sun of Japan award by the Emperor, when he pushed us and he connected us to the right thinking people in the Japanese government and our friend Matsumoto-san. It's a pleasure and honor taking our learning, our experience to the participants present here. Let me tell you that the participants present here are almost from every educational institution of the country, starting from Nagaland to Jammu and Kashmir. People from the industry are present here today in a very big way because of India's and Japan's commitment to the SDGs. We are aware that SDGs are going to open up tremendous opportunities for the businesses, for the society, for the students, and for very healthy and progressive, responsible lives for all of us. I only make one appeal to the participants here right now, that please connect with us, New Delhi Institute of Management, for working together with Japan on SDGs, for joint research papers with us. We have been training a lot of Japanese companies on artificial intelligence and digital. So we can, all of you, the people from academia, the people from the industry, we can together work a lot. You can help us and we can certainly help you. And we have a very successful mentorship program where people from the industry come online for 2-3 hours every month to speak to our students. So I invite all the interested friends to please come forward. I'll not take much time. That was my simple remarks in the beginning. So please over to you, Nikhil, so that we start learning from great people present today. And my request to the panelists is, let us start working together in a much bigger and deeper way. Today should be another bigger beginning, which should be followed up on regular and continuous basis. I can only assure you that we are very keen. All the friends from Japan, they've seen our commitment during the last 3 years, and I'm grateful that they continue to support us. Today, when India and Japan are moving together hand in hand at the global and international platforms, let us also together contribute whatever little bit we can do towards that big effort. Thank you very much for being with us today.
Thank you, sir. Over to you, Matsumoto-san.
Yes. Good morning, everyone. Namaste. मेरा नाम कात्सुओ मात्सुमोतो है. मैं जापान से आया हूँ. So इस कोरोना के समय में मैं आशा करता हूँ कि आप सब ही कुशल मंगल होंगे. So it is my very pleasure to hold this seminar today in cooperation with NDIM. And the chairman Bansal and the Professor Singh, thank you for giving a good occasion to us. I hope that many of you will learn about the significance of the SDG, and let us introduce Japan's effort in this regard today. And I prepared the presentation paper, so let me quickly go through them. Next. Yeah, the SDGs is not a government matter, but we require the cooperation with the private sector and civil society organizations. We invited 3 Japanese companies that are going to make a presentation later on, a really good example of contributing to the SDGs. And today, let me quickly go through the Japan's effort and the JICA's activity and the JICA's challenge and actions. Next, please. And I believe that today, the listener who wants to do the business in the near future can contribute to the society. So I'm sure that the presentation today is very good reference for every participant. And the SDGs, as well known that the International Development Goal and the target for the year 2030. And maybe you know the Millennium Development Goal that was set in 2000, and they made a significant contribution to the poverty reduction and the other issues. Next. Yes, this is kind of like a relation between the MDGs and SDGs. And the SDGs, which began in 2015, is more comprehensive in terms of the coverage of target. In particular, the slogan, nobody left behind, emphasize inclusiveness, which is a really hallmark of the SDGs. So today, the government of India is also making the big effort to ensure that all the village and the people benefit from the water, electricity, and the other type of the government service, including the healthcare. So you will hear about the India's effort to address the SDG from NITI Aayog later. That is a very good input to the all participants today. Next. In Japan, a committee chaired by the Prime Minister has set up to work on activities to achieve the SDGs. The committee issued the implementing guideline and also the policy matters, which consist of the priorities and specific measures. And it is often said that the number of women in society is low in Japan. So we are also focusing on the policy to promote such kind of like a participation of the women to society. Next, please. Yes, this is SDG Action Plan 2020. There are 3 big pillars. One is we try to promote business and innovation. They are very key to promote SDGs. Second is the vitalizing the local economy, utilizing the SDG as a driving force. And there's a lot of the town and the village in Japan that they are now have some like program with the economic development. So they try to vitalize the activities in local area. And also, as I mentioned, that they try to empower the youth and women through these SDGs. Next, please. And as I mentioned, that not only the Japanese government, but also the Japanese companies very making effort to contribute to SDGs. And the Japanese Economic Association, Keidanren, it's very similar to the CII and the FICCI in India, cooperating with the government effort and providing the guidance to their member companies. In addition, the government has launched the annual award system to recognize the companies that have contributed to the SDGs. And Japanese companies that will give you presentation later, in fact, the winners of this SDG award. And I'm very looking forward to hearing about what they are doing to address the SDGs today. Next. So we are working with JICA. JICA is a government development agency of Japan, helping the development effort of the countries to achieve the SDGs. And we provide fund for infrastructure development, technical assistance for knowledge and technology, and financial and research support for the private companies. Next. Yeah, there are several types of the cooperation, and the first photo is like a photo of Delhi Metro. And we have been supporting the Delhi Metro in the past 20 years. And this transportation system is not just say we're contributing to the moving of the people, but also well, the supporting the especially women who can reach the jobs and the other benefit more easily. And in India, we have also supported like water supply, irrigation facilities, forest reservation, and so forth. Next. Yes, they are just a photo of the just example of a contribution. That this is say project in Sri Lanka, focusing on the elementary schools. We have been working with one private company who provide a good e-learning system to the student there. So we try to support the concept of the education for all children in world. Next. Yeah, this is say a program in the health sector, especially focusing on the maternal and child health. Yeah, we have been working with more than 20 countries to distribute such kind of like a good system for the like a mother to check and monitor the health of the kids by utilizing the good tools. Now, because of the say the good use of the smartphone, it is very easier for the many people to utilize these tools. Next. Yes, and in India, we have been working with NITI Aayog to support the India's effort to achieve the SDGs. And the program is promoting the monitoring system and strengthen the policy measures and also framework of the Indian side to accelerate the implementation of the SDG program in each level and each sector. And the aspirational district program is kind of like a very common program under this project. And we are very, very glad to work with NITI Aayog for being really keen to achieve SDG in India. Next. Yeah, and as I mentioned that we provide some fund to the private sectors to contribute to the SDGs. And now not only India, but also in many countries, such kind of like companies are working for the purpose. And we believe that after my presentation, that these three companies can really give you the good input about the activities related to the SDGs. Next. And finally, I'd like to really emphasize that achieving the SDGs is not someone else's business, but rather that we must act on our own. So I would like to urge everyone listening today to start acting on these issues as their own. So now let's move on to the next presentation. Thank you for your attention. Thank you very much.
Thank you, Matsumoto-san. Next presentation is by Shimada-san. Shimada-san, can we have your presentation, please?
Okay, thank you so much. Can you see my presentation now?
Yes, Shimada-san.
So let me start my presentation. Good morning. I'm Minoru Shimada, Managing Director of Yahoo Danone India. So at the outset, I'd like to appreciate distinguished Dr. Vishwa Mohan Bansal, Chairman, NDIM and PhD CCI Education Committee, and Honorable Mr. Soumitra Mandal, Director NITI Aayog, and distinguished Mr. Katsuo Matsumoto, Chief Representative JICA India Office, and other Indian friends and colleagues for giving me opportunities to present Yakult. So today I'd like to introduce some SDG activities, mainly in India, by Yakult. So there are 4 contents today. So I'd like to quickly introduce the company and the product. And after that, I'd like to introduce 3 important fields of SDGs, which are empowerment of women and health and environment. So let me introduce our company. Our parent company is Yakult Honsha in Tokyo, Japan, which was founded in 1935 by a Japanese medical doctor, Dr. Minoru Shirota at Kyoto University. And our main business is developing, manufacturing, and marketing probiotics fermented milk drink in the world. And now Yakult is present in 40 countries and regions, including India. The red color countries, now Yakult is present. And net sales is more than 4 crore bottles per day in 2019. So I think some of you may not be aware of the probiotics. So let me share the official definition of probiotics by WHO. Probiotics are live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. So this is a definition by WHO. So probiotics are good bacteria, health-promoting bacteria in the intestine. Its antonym is antibiotics. So sometimes you take antibiotics to kill all the bacteria in the intestine, both good and bad bacteria. But you can't rely on the antibiotics for long because there are side effects, such as killing good bacteria in the intestine. So probiotics are beneficial, health-promoting bacteria that can increase our own good bacteria in the intestine and decrease our own bad bacteria in the intestine. It is important for good bacteria to outnumber bad bacteria in our intestine, since they can occupy the surface of the intestine and prevent harmful disease-causing bacteria from increasing in number. So this is the concept of probiotics. So let me introduce Yakult Danone India. It's a 50-50 joint venture between Yakult Honsha in Japan and Danone Group France. Both are the global leaders in probiotics. And we commenced the Indian operation in 2008. And now we are manufacturing probiotic fermented milk drink Yakult at our own state-of-the-art facilities at Sonipat, Haryana State. So all the manufacturing equipment are imported from Japan, and the Yakult has been manufactured automatically without human touch in our factory. So let me introduce important values of Yakult India. I advocating that our slogan as "Let's become the most desired and required organization in the society." And our mission in India is we contribute to the health and happiness of people in India by providing high quality products along with high quality services. So in India, we have 2 products. The red one, Yakult Original, and the blue one is Yakult Light. And Yakult Light is a premium sister product with reduced sugar and calories and vitamin D and E added. And each bottle of Yakult and Yakult Light contains more than 6.5 billion Yakult's unique probiotic strain, Lactobacillus casei strain Shirota. And no preservatives and no colorings. And there are more than 100 human studies done on the effectiveness of LCS. So from this page, let's move on to the Yakult CSR, SDG, ESG policies. Actually, SDG policies are incorporated in this, and we set 3 important areas, such as local communities, health, and environment. So let me introduce our activities one by one. So firstly, let me introduce our activities on empowerment of women. In India, we have very unique distribution system that is called the Yakult Ladies Home Delivery System. Now there are more than 300 Yakult ladies, mainly in Delhi NCR, Chandigarh, Jaipur, Mumbai, and Pune. So who are Yakult ladies? Yakult ladies are women between 18 to 50 years old who drive scooters and visit house customers and office customers. And Yakult ladies are health ambassadors of Yakult in her area. Each Yakult lady receives around 18,000 rupees plus sales commission per month in Delhi and become financially independent. This system contributes to the empowerment of women in India. So educationally, most of Yakult ladies are class 8 to 10 and belong to the underprivileged society. And they can climb up the corporate ladder and become a manager. The company trains Yakult ladies for 3 months with salary on how to communicate with colleagues and customers and how to drive scooters and Yakult related knowledge. So most of new Yakult ladies think Yakult is just like a school to teach them how to communicate with each other. And once in 3 years, Yakult ladies with excellent performance are entitled to attend Yakult International Convention in Japan. In the world, we have more than 80,000 Yakult ladies, and this Yakult lady system has been contributing to the empowerment and financial independence of women in each country. And in Japan, Yakult ladies are supporting elderly who live alone. As you may know, Japan is the aging society with less children, and there are many elderly who live alone. So to check their safety and health, Yakult lady deliver 1 bottle every day. So this is called as home delivery with love and care. And now more than 800 local governments are supporting these activities to increase the number of visits to the elderly. So let me shift to the health. Promoting good health is also important for the healthy society. And we have our science team in the organization, and they are conducting health lectures to school children. So for example, in 2019, we conducted 304 health lectures for more than 89,000 students at schools. From July 2020, we started to conduct it online. So the purpose of this health lecture is to educate students about the importance of a balanced diet and healthy lifestyle, and also to explain about the digestive system and help them understand the importance of the intestine, which plays a role of digestion and immunity. I know intestine is ignored in India, but the health of intestines is quite crucial because it helps digestion and absorption and stimulating immunity. Intestine is the largest immune organ since about 90% immune cells reside in the intestine. So we are also donating a product to the hospitals and elderly houses to boost their immunity to prevent infectious diseases. So in 2020 till today, we donated 137,000 bottles of Yakult to 91 hospitals, elderly houses, policies, and other organizations to help them improve immunity. So these are the photos taken by the hospital physicians and nutritionists, or even police people. And we received so many appreciation letters from the hospitals and elderly houses and the police stations. And promoting science is also quite important for the healthy society. So the National Institute of Cholera and Enteric Diseases in Kolkata conducted one of the largest community-based clinical trials to check the effectiveness of probiotic drinks against children's acute diarrhea. Unfortunately, in India, more than 2 lakh children suffer from acute diarrhea, and most of them died of it. So tackling acute diarrhea or malnutrition problem is still a significant issue in India. So we provided the probiotics product and a nutrient product, which is called placebo, is made from same ingredient without probiotics. So the researchers at the National Institute of Cholera and Enteric Diseases gathered more than 3,700 children from 1 to 5 years old. And they divided those children into 2 groups. One group drank probiotics drink Yakult for 12 weeks, and another group drank nutrient placebo drink for 12 weeks. And they checked the occurrence of acute diarrhea for 12 following up weeks. And these are the photos taken by them. And Dr. Su, the principal researcher at NICET, found that taking probiotic drinks for 12 weeks resulted in 14% reduction in children's acute diarrhea. So 14% reduction is significant in this country, and it can contribute to saving the important lives of children in Kolkata or other cities. And I'd like to share another clinical study conducted by Professor Gleason at Loughborough University in UK. He gathered 84 athletes in the university and divided into two groups. One group drank probiotics drink for 16 weeks, and another group drank placebo drinks for 16 weeks. And Professor Gleason found that the risk of infection, the upper respiratory tract infection, decreased by about 50%. So he also found that IgA antibodies, one of the immunity, was also much higher in probiotics groups. So finally, let me introduce some activities on environment. So our products are made from plastic bottles and plastics packagings. So it's quite important for us to comply with extended producers' responsibility set by the OECD. So EPR is policy approach under which producers or brand owners like Yakult are given a significant responsibility, financial or physical, for the treatment or disposal of post-consumer products. So we made a plan to collect the plastic wastages from the market and submitted it to the Central Pollution Control Board under the Ministry of Health and Family Welfare. And they issued the EPR registration certificate to us, like the attached. And we made an agreement and appointed waste management company, NEPRA, headquarters in Ahmedabad, and waste management NGO, IPCA, Indian Pollution Control Association. And they collected the plastic wastages from the market by using our fund. So the local municipal corporation have appointed them as the waste management companies in each state. And in those states, we have appointed them to collect plastic wastages from the market. So they collect the plastics wastage, which weigh more than what we manufacture at our own factory. So we can say Yakult is a plastic neutral in India. So by using the fund raised by the different companies, they are ramping up the facilities to collect and sort out the wastages. And they are educating rag pickers to improve their safety and their efficiency to collecting dry plastic wastages from the market. So these activities are collaborated between the waste management company and the NGO and industries like Yakult and other companies. And you may think that biodegradable materials can solve all the plastic issues, but they are not panacea to the plastic issues in the world. So why? According to the UN report, Single-Use Plastics, a Roadmap for Sustainability, published in 2018, biodegradable plastic items break down in the environment only if exposed to very high temperature, such as above 50 degrees, which is very rare and unrealistic. And this material doesn't degrade completely in the ocean. It will trigger microplastic issues. Microplastics are very small plastic ingested by the zooplankton in the ocean. And zooplankton are the bottom of the food chain, and we are the top of the food chain. So we will take microplastics by eating fishes or other marine creatures. So further improvement of biodegradable materials is awaited by the food industries. In addition, biodegradable materials will promote littering plastics without investing in the collection and recycle equipment and organization. So I'd like to emphasize the importance of collection and recycle together with the development of the biodegradable materials in the world. So I hope you friends don't look down on the importance of the collection and sorting out and recycling the plastics. Even we have the biodegradable materials. And this is the last slide. So our staff is not hesitant to clean up the environment surrounding us. So thank you so much for your patient listening. That's all from my side. Thank you, Professor Nikhil. That's all.
Thank you so much, Shimada-san. Wonderful presentation and wonderful initiatives. Now I would like to request Sakata-san to start your presentation, please.
Okay, so now you can see my screen.
Yes, Sakata-san, we can see your screen.
Okay, yeah. Hi, good morning. At first, thank you for NDIM and JICA and all people for inviting and giving us a good opportunity today. So I'd like to share about the company's approach for SDGs and also how we are tackling the global challenge of the sanitation and hygiene. So our Lickstreet Corporation born in 2011 through a merger of 5 Japanese companies. And today we have about 75,000 employees in more than 150 countries worldwide. So in India, we are mainly selling Grohe and American Standard brand products such as faucet and sanitary wares. Also later, I'm going to explain about our Sato brand, which is offering in Indian market. So at first, let's talk about Lickstreet's approach to corporate responsibilities. I think there are differences in thinking and understanding between the companies. Also, in the past, corporate responsibilities and business activities were often considered separately. So when I discuss it within the team, we always ask about 2 simple questions. Why do corporates exist? And also, what is the value of the company to societies? And the answer is we believe that the company cannot survive if it doesn't pass this. So our CEO, Mr. Seto, clearly mentioned corporate responsibility is the foundation for sustainable growth, and corporate responsibility strategies should align with business strategies. So this is our thought of the corporate responsibilities. So always corporate responsibility and the business is together. And here's our corporate responsibility strategies. And there are 3 pillars: global sanitation and hygiene, water conservation and environmental sustainabilities, and diversity and inclusions. And our Sato business division is one of the vehicles for global sanitation and hygiene, and trying to achieve by 2025, improve the livelihood of 100 million people through sanitation and hygiene initiatives. Then going to the Sato business. So here's a global sanitation crisis. So now still 2 billion people in the world today lack access to improved sanitation facilities. So this is a quarter of the world populations. Also, lack of sanitation cost is very huge. For India alone, it's about 54 billion USD, which is about 5.6% of Indian GDPs. Also, 80% of illness in developing countries linked to poor water and sanitations. From previous research, it was estimated over 800,000 children younger than 5 years of age perish from the diarrhea disease each year. So therefore, LICS is addressing the global sanitation hygiene challenge. This area related to Goal 6 of the United Nations Sustainable Development Goal, which aim to ensure access to water and sanitation for all by 2030. And now you can see our product portfolios from the luxury premium segment to basic sanitations. So LICS's wide portfolio of brands enable us to cater to the broadest perspective of consumer lifestyle and needs. So LICS has incorporated design and technology to solve real consumer needs in all of bathroom products. Also, it's dedicated to improving accessibility to basic sanitations as an opportunity to solve one of the world's greatest challenges. Also, Sato is a unique design, reduce odors and the risk of the exposure to waste, easy to clean, and use less water per flush. Overall, this results in better user experience to encourage them to keep using the toilet and therefore reinforce a move away from open defecation. Also, here is our unique business model. Sato is responsible for developing solutions tailored to the local environmental, and through license agreement with local partner companies, we manufacture, sales, installation, and maintain of the Sato together. And now you can see the cycle of the make, sell, and use. We enable local community to improve sanitation in an independent and sustainable manners. Also, we create employment opportunities through our business. So we started our business 2013. So since 2013, Sato has cumulatively shipped over 3.8 million units, enabling improved sanitation for an estimated 18.6 million people in over 38 countries. So let me introduce about Sato in India. So last year, Swachh Bharat mission was over, but before that, the Indian government is promoting the adoption of the twin pit power flush latrine systems. So our business approach is always same. So Sato is responsible for developing the solutions tailored to the local environmentals. So at first, we are trying to find the current problems. So what is causing the open defecations? So when we started research in India, we found out some problems from the existing solutions. So now you can see the superstructure of the toilet, and this construction model is created last 4 decades and without no innovations after that. So this toilet system uses high waters. Also, it needs a pit switching system named junk box. And this junk box sometimes causes clogging. That's why people stopped using the toilet. So our chief designers found out these problems and produced a new product named V-Trap systems, which you look at in the pictures. Also, not only develops a new product, but also we trained women masons in the communities to provide the proper training, enhance the use of the toilet for long term. And also, they can maintain by themselves, which will create sustainable solutions in the communities. So in this training, we trained more than 450 masons and construct 49 toilets. Also, this training workshop was to empower women to earn better and respectable earnings for their families. Also, to promote the toilet, this is one of the activities. Community sanitation complex, a great way for behavior change. So we built this toilet and pushing people to stop open defecations and choose hygiene and safe sanitation options. And after the COVID pandemic, we also think about how we can support the communities. So we collaborated with UNICEF and provided 4 mobile toilet units in Mumbai. Also, other areas, we provided toilet with proper shelters. So our business division is always thinking about the innovations and even COVID situations. So our chief designer, he produced a new product, hand washing product named Sato Tap in the lockdown situations. So as I say, at first we are trying to find problems. So for hand washing, 3 billion people, about 40% of world populations, have no ready access to a place to wash their hand. Also, COVID is highlighting vast inequity in access to water, sanitation, and hygiene. For many households in developing economies, its difficult situation made worse, complicating the already difficult to follow guidance on social distancing, hand washing, and other best practice. Also, existing product also had a challenge. Encourage gathering, especially installed in school and public places. Most require high contact, which increases contaminations. Also, in the household level, no viable solutions at scale. So now you can see the pictures. Boy is washing his hand, but he needs support of his parents. So current existing product is difficult for kids to use. Also, it requires waters, easy to break, also expensive for BOP users. So in the lockdown situations, our designer produced this new hand washing solution for all. So at first, product feature is very unique design and just less contact. Also, it's very compact and light, so can use both households and public facilities. So it's very compact and light, so wherever you can bring and you can use and you can wash your hand. Also, every pet bottle fit to this Sato Tap. Also, you can see it's a soap dish, so easy access to soap, which means reinforcing hand washing with soap behaviors. Also, these trickle actions minimize waters, meaning fewer refills. Also, easy and quick on and off operations. So even young children can use these hand washing stations without parent support. So currently, we are testing this new product in the street food stand in India. There is no hand washing facilities, so the response is very positive from users. So now we are preparing for the mass productions, and once we are ready, we will start to roll out. So this has one more challenge for us to accelerating the rollout. So our company committed $1 million USD to support to roll out the product. Also, Lixil and UNICEF has a partnership. So we will also expand activities in hand washing and sanitation in response to COVID-19. These activities range from collection of the commercial and the behavior insight to strength behavior change, and joint advocacy to promote the hygiene programming. Also, LIXIL already works with a range of partners in the sanitation and hygiene space, including JICA from Japan, USAID, and more. And with JICA Ethiopia, we collaborate with JICA and we decided to donate about 9,000 units of sato tap to the communities to improve the hygiene. Okay, so I want you to watch the about a new product. Yeah, so thank you for the listening my presentations. And at the end, so we are the public sector companies and we are focused on the producer product. But at the same time, we need a partnership with the government, NGOs for advocacy. And also we need a strategic partners like UNICEF or JICA. And I think for SDGs approach, we cannot achieve by only one private companies. But if we have like two or like three partners, we can achieve our target. Yeah, thank you for listening my presentations.
Thank you, Sakata-san. Very innovative product, I must say that. Thank you so much.
Thank you.
Can I request Mori-san to start a presentation?
Yes, let me start. Yes, my presentation. I'm Madoka, working as Vice Director. Just a moment. Sure. I'm working as a Vice Director of Africa Business Development Section in Saraya. Saraya is graded as an SMEs and is located in Osaka. In India, we also have a subsidiary called Mister in Mumbai. I was very interested in working in this company because Saraya was one of the famous companies doing business in developing countries. From my own experience, I want to make a career out of solving social problems, and I believe that the best way to do so is through business from the perspective of country. From now, let me explain our business in Uganda. First of all, let me introduce what is Saraya. Our business philosophy is, just a moment. Our business philosophy is based on the three keywords of sanitation, environment, and health. And we have been developing products. Just a moment, sorry. Okay. And we have been developing products and providing services for all, as we have produced what it would be nice to have to solve the social issues. Our product number has grown to over 5,000 products. The solution of social issue was become an universal theme of achieving the Sustainable Development Goals. Through these activities, Saraya received the first Foreign Ministers Award of the Japan SDGs Award. Saraya had been established in 1952 after World War II. Saraya made this wallpaper, which was made to advertise our liquid hand soap called Chabonet. It was used to spread the importance of hand wash with the message, wash your hands. At that time, dysentery was one of the prevalent diseases in Japan. This graph is indicating that the cases were over 111,000 in 1952. To cope with this situation, Saraya designed and created the first liquid hand soap and dispenser in Japan. This liquid soap named Palm. It was the first liquid soap containing a bactericide in Japan and was originated from palm oil. As of today, Saraya has 55 branches in Japan. Headquarters are located in Osaka and in Tokyo, respectively. Saraya also has 23 subsidiaries overseas. Asia is the biggest target since it's geographically easy to access from Japan. Saraya also has 8 factories in the world. For African customer, Saraya Uganda is available to supply hygiene product from Uganda and Kenya. From this slide, I want to introduce why we started doing business in Africa. To celebrate Saraya's 60th anniversary in 2010, we organized a memorial project called Wash a Million Hands Project with UNICEF Uganda. This picture is showing the strategy of this project. When customers buy target product, 1% of the sales goes to be pooled as charity for UNICEF Uganda. By starting this project, we went back to 60 years ago in Japan. We promoted the importance of hand hygiene for a long period because infectious diseases are mostly preventable by hand hygiene, are still one of the main causes of death in Uganda. Therefore, we Saraya have studied to contribute to the sensitization of infection prevention by hand wash with soap in Uganda. Through this project, we have been continuously promoting the importance of hand washing. So far, we have talked about Saraya. From now, I will be talking about the relationship between hand washing and MDGs. This was the common goals of the international community in the field of development set by United Nations as MDGs at the United Nations Millennium Summit. As a leading hand hygiene company, Saraya has set a contribution to the focal theme 4 and 5. Since we looked at WHO World Health Statistic in 2010, under 5 mortality rate per 1,000 people were all over or around 100. If we compare with Japanese mortality, Japan was 3. Under 5 mortality is mainly due to a diarrhea disease, which is actually a preventable infection disease. Since we looked at maternal mortality rate per 100,000 people were over 300 in each East African countries. If we compare with Japanese mortality, Japan was 5. Sepsis is a leading cause of maternal death and is considered to be a preventable infection. So, what percentage of patients do you think we can save from these under 5 and maternal deaths? Answer is 75%. There is a simple way to save lives by hand hygiene. Saraya has more than half of the market share in Japan as a leading hand hygiene company, but we didn't know how can we spread hand hygiene, what we did in Japan and Uganda. Therefore, we used JICA's survey on BOP business for the research of the demand of alcohol hand sanitizer. We chose two pilot hospitals called Entebbe hospitals located in the area where the international airport is located, and the Gombe hospital, which is 2-hour drive away from the capital city Kampala. Entebbe hospital is known as the waterfront hospital of the international airport and is engaged in infection control at the airport. Gombe Hospital was located about 2 hours drive off the main road with unstable water and electricity. To illustrate the hygiene condition in the public hospitals in Uganda, here are some photos of the actual medical device reprocessing systems taken at Entebbe Hospital. This picture shows a kidney dish being disinfected, but the disinfectant is cloudy. This solution was sampled and sent to culture, and the bacteria were detected. Thus, we found that there were challenges in ensuring safe hygiene management. This is the operating room at Gombe Hospital. The ceiling was come off and it looks like falling down at any moment. There is no water coming out of the tap, so they had 3 tanks as shown on the right to store and use rainwater. Rainwater from this tank was collected and cultured and was found to contain spore, which does not die even when heated to 100 degrees. In order to improve sanitation in the Ugandan public hospitals, we decided to start by confirming the importance of alcohol hand sanitizer and spreading the correct infection control measures in the right way. The method is produced by WHO and its name is My 5 Moments of Hand Hygiene. There are 5 moments to apply hand sanitizer in a hospital setting as this picture. According to this procedure, hand hygiene instructor in Uganda sensitized the timing and the proper way to apply hand sanitizer. In addition to education, evaluation and feedback are also important tasks to embedding the activity. This graph is showing the cases of acute diarrheal disease with red, and the sepsis after Caesarean section with green at Gombe Hospital, and the compliance rate of hand sanitizer with blue studied at the same time. The number of infection cases in the hospital, which was about 3 cases each month and as many as 6, but dropped as the hand compliance rate went up. And in good times, there were months when the number of cases that were present each month went down to 0, especially November 2012 to February 2013. In short, we have proven that the adherence to hand hygiene can prevent hospital-acquired infections. The data was honored with the WHO Global Health Workforce Award, recognizing that the alcohol hand sanitizer reduced hospital-acquired cases and reduced the number of patients' hospitalization period. 2-year survey conducted as a JICA project confirmed that there was a demand of hand sanitizer, so we have begun to consider local production in Uganda as a next step. In anticipation of cooperation with Kakira Sugar Factory, which is Uganda's largest sugar factory, we have begun construction of the plant in the site. Kakira Sugar Factory is an Indian company and is one of the 3 largest sugar companies in terms of market share in Uganda. We are using ethanol originated by molasses, which is resulting as a byproduct from refilling sugarcane. Normally, molasses is discarded. This is a picture of production in the factory in Uganda. There are currently 8 people working in the factory, led by the Ugandan factory manager and quality check staff. As you can see in the map below, Uganda shows a huge amount of alcohol production compared to the neighboring East Africa. The gin called Ugandan Waraji or Nile beer are popular drinks locally made in Uganda. We use local raw materials as much as possible and manufacture locally by utilizing local human resources. It results sustainable production and supply hand hygiene in Uganda. This is a product made in Uganda named Alsoft B. Here's what we did in marketing in Uganda. Of the 2 labels of sanitizer, one of them is made in Uganda. You can see which one is made in Uganda. Please look at right label. Japanese quality and bigger logo, bigger company logo. The answer is right. Japanese companies are still newcomers in the African business. Mostly, business share is taken by Chinese and by Indian, not by us Japanese. The company logo is a marketing strategy to spread the name of the company. So we try to call every hand sanitizer Saraya, and we achieved actually. We began our work in 2011 and have continued to do so since then, resulting in the recognition of Saraya by President Museveni of Uganda. Currently, under President Museveni's leadership, Uganda is working to value domestic production. Saraya's hygiene business is also recognized as one of the important social business in Uganda. That's all my presentations. Thank you so much.
Thank you, Borisan. A very, very informative presentation. Yeah, and amazing work. Thank you so much. Over to you, Soumitra ji. Let's talk about Niti Aayog and what is your
a very good morning to Matsumoto-san, Chief Representative of JICA, Chairman NDIM, Dr. Bansal, Professor Nikhil Singh, all distinguished panelists and my dear friends. So I would like to thank NDIM for organizing this very, very insightful webinar on Japan's support for SDGs in India and how it has led to a huge opportunity for jobs, academia and business, a very relevant topic. And I also extend my heartfelt thanks for inviting me to share my thoughts and experiences on this matter. So I will not be sharing any presentation. I thought that I would rather narrate the story of the Aspirational Districts program because it has been one of the best governance reforms and I think probably the biggest governance reform in the entire world. So to start with, I would say that India has assumed a leadership role in localizing the SDGs. And it is the first country in the world to bring its subnational governments on board and it's monitoring their performance through the SDG index, which is prepared by Niti Aayog on an annual basis. So ranking the states on the basis of different SDGs, it has helped the states to identify the areas that require sustained efforts while also appreciating their efforts which have produced visible change. And I'm proud to say that Niti Aayog is not merely periodically collecting the data on SDGs, but it's also acting very proactively to fructify the goals and targets while maintaining very high standards of quality. So one of the flagship initiatives, as I already mentioned when I started, this is anchored by Niti Aayog, which shows this action-oriented approach towards the achievement of the Sustainable Development Goals is the Aspirational Districts Program. So Japan's institutional actors, I would say, like the Japan Bank for International Cooperation, the Japan External Trade Organization, they have nurtured a very healthy working relationship with Invest India and its Japan Plus team. JICA has stationed its consultants at Niti Aayog to basically support us in implementation of the Aspirational Districts Program. And I'm proud to say that regular interaction between the stakeholders on both the sides, it has become a norm and has increased the number of touch points between the states, the state machineries of both the nations. So while a bulk of this assistance, which is known as the official development assistance, we call it ODA in brief. So while a bulk of this assistance is utilized for building infrastructure, various kinds of projects, a portion of this is also being used in social sector programs, like the Aspirational Districts Program. Therefore, the ODA from Japan, I would say the ODA from Japan has seen greater diversification in its utilization and has opened many new domains of cooperation. So now something about the Aspirational Districts Program. It is a very, very talked about program, and even people from United States of America, professors in Harvard Business School, they have also come up with a latest assessment report on the Aspirational Districts Program. So this program launched by our Honorable Prime Minister in January 2018. So it is basically the program monitors the performance of 112 districts from 26 states and one union territory, the Union Territory of Jammu and Kashmir. So we monitor the performance of these 112 districts on 49 key performance indicators. And these key performance indicators are across 5 critical sectors, including health and nutrition, education, agriculture and water resources, financial inclusion and skill development, and basic infrastructure. So almost 18% of India's population resides in these 112 very, very remotely located districts. So as Matsumoto-san reminded during his brief address to all of us, that SDG's commitment of leaving no one behind. So our Honorable PM has said it several forums, leaving no one behind. So these are those 112 districts that were left behind since many years, and that's why they were picked up. They were shortlisted for this program, which is a wonderful program on inclusive development. So all these sectors in the Aspirational Districts Program and the indicators which are monitored, the 49 key performance indicators which I mentioned, so they are directly linked with the SDGs. Almost around 15 SDG goals are linked to all these 49 key performance indicators. Of course, these 49 key performance indicators have been further segregated into 81 data points, encompassing almost around 99 schemes of Government of India. So in the last 2 years, since its launch, now it's almost, it would be 3 years in the month of January, all the aspirational districts have gradually internalized the guiding principles of the program. We call it the 3 C's. The first C stands for convergence of all the central schemes, the centrally sponsored schemes, the central sector schemes, the state schemes. The second C stands for collaboration. By collaboration, we mean between all the stakeholders, and center is a stakeholder, state is a stakeholder, district administrations, they basically drive this program. Then we have almost 20 development partners. JICA is one of our very, very big development partner. And the third C stands for competition. Competition amongst these 112 aspirational districts on their monthly performance, the delta performance we say on the 49 key performance indicators. And lastly, it's a mass movement, as our Honorable PM always emphasizes, that Jan Andolan should be a very, very integral aspect of all the programs to make them sustainable. So mass movement, of course, is a very, very integral part of this program. So inculcating the spirit of collaboration, the district teams, the district teams are led by the district magistrates. and they are heralding their respective districts into a new era of hope and aspirations through this program. Today, I would say the program represents a very, very unique model of data-driven governance supported by the evidence-based policy interventions. State governments are also very actively adopting the aspirational districts program template to bring about very rapid transformation in the other districts of the state, in the underdeveloped blocks of the states. Honorable PM has, in his numerous address, he has also asked the state governments to replicate the template of the aspirational districts program for rapid transformation of the underdeveloped blocks. So many of the states have adopted this approach, are replicating this aspirational districts program template for bringing transformation in their underdeveloped blocks as well as underdeveloped districts. And as I said, independent assessments of the program, they have also a very, very recent report by two professors of Harvard Business School and MIT School, Sloan Institute of Management. They have also attested the fact that all aspirational districts, since this program has been launched, all the aspirational districts have shown significant progress, especially in health, nutrition, education, and infrastructure sectors, and that too in a very short time, because as I said, it's just more than 2.5 years for this program. And the best evidence of this new emerging paradigm in the aspirational districts is the emergence of numerous innovative best practices. As many of these districts are facing common challenges, they are seeking inspiration in the success of the other districts, and they are replicating the best practices to deal with their own challenges. So in a way, it has emerged as a wonderful and a very beautiful collaboration between the districts as well. On a particular front, they compete with each other, and on the other front, they basically replicate and learn from their peers' best practices. So, and in some instances, these challenges are unique and are being tackled through innovative solutions, which are identified by a pooling of knowledge and experience of all the stakeholders. As I said, that it is one of the probably the biggest governance reform in the entire world with so many stakeholders. So according to latest reports, as I said, the aspirational districts program has led to significant progress in multiple key performance indicators across these districts. Some of the indicators, which were very, very key indicators, they have even reached near saturation levels across most of the districts. I would to name a few, like the household electricity connection, the individual toilets. These are a few which I am naming. Others have also reached to near saturation levels. And we are in the process of basically formulating some new indicators, removing the saturated ones and bringing the other ones. And the program has also been credited with expanding the coverage of various central schemes which are aimed at financial inclusion and for enabling sustained improvement in children's health and nutrition, especially in reducing malnutrition and increasing the immunization coverage. So by covering 5 critical sectors, the program has a major impact on India's progress in localizing the SDGs. So a very important component, I'm coming to where basically we have got a lot of help from JICA. So a very, very important component of the aspirational districts program is to reward the well-performing districts. Every month we do it. Every month we come up with the ranks, individual rank in individual sectors. There is one overall rank 1, rank 2 in the overall by calculating the scores improvement in the overall sectors as well as these individual sectors. And whichever district secures rank, we reward them with some additional untied funds. And these funds are basically these funds give the district freedom to use this reward money in whichever way they feel appropriate to meet critical gaps in their district. So, and for the utilization of these funds, it is essential for the district administration. We have made it essential for the district administration to basically formulate some project proposals for meeting their critical gaps and project proposals and plans of actions. And it is here in which Japan's official development assistance, of course, to JICA, has been a great enabler for the underdeveloped pockets of India to localize the SDGs and move India closer to the to its 2030 targets. So the government of Japan through JICA has committed around 15 billion Japanese yen, which is roughly around rupees 970 crores for helping it achieve the SDG targets. So to utilize these funds effectively, as I said, for the benefit of the most underdeveloped districts of India, in January 2019, means almost a year after the Aspirational Districts Program was launched. So in January 2019, the externally aided program for the SDGs was launched. And since then, we have been, through NITI Aayog, we have been allocating almost rupees 30 crores every month to these districts who secure rank by their overall their delta performance every month. And I'm happy to say that as on date, we have been able to release almost around rupees 240 crores to almost around, I should say, roughly around 50 districts for undertaking projects across these important 5 sectors. And another 50 districts are in the process of formulating their project proposals. So in a couple of months, that we would be able to cover almost all the 112 aspirational districts. And to assist and handhold the district administration in formulating these projects, the NITI Aayog has constituted a project management unit consisting of experts, sectoral experts from Asian Development Bank and UNDP. And these domain experts, they even travel to the districts, they study the situation, the ground situation in the district, and then they help the district administration with the project formulation, with the identification also of the projects. They help the district administration. And just to give you all an idea of the kind of projects that have been implemented in the aspirational districts through this development aid. So, for example, upgrading their health facilities, procuring essential medical devices and medicines, then upgrading the government schools by installing smart classrooms. Some of them have been very, very popular and very, very successful. Then creating assets for water conservation and irrigation, then appointing specialists in hospitals. There are districts very, very far flung. As I said, that most of these districts are very, very remotely located and they do not have specialists. The specialists don't agree to travel to these districts. So we have also even funded the districts to appoint specialists in hospitals, teachers in schools, then procuring bike ambulances for transporting pregnant women in difficult terrains, and plethora of such other projects. And these projects have greatly benefited these districts in meeting their critical gaps, as I said, and improving their performance of the key performance indicators, the 49 KPIs that we had identified for this program. And thus, in a way, it is helping very, very positively affecting the lives of millions of people residing in these 112 aspirational districts. So while this particular component of Japan's ODA is not directly used, because it's not directly used for creating livelihood opportunities, because as this webinar is mainly on creation of, how Japan's ODA is helping in creating the huge opportunity in jobs, academia and businesses. So I thought that I should specifically mention that this component of Japan's ODA is not directly used for creating livelihood opportunities. But many districts have used it for empowering the women-led self-help groups, which is helping in not only improving the household incomes but also empowering women. So one needs to see that how this program has, through of course Japan's assistance, through the official development assistance, we have been able to reach through this program to millions of people, and we have been able to make a direct impact on their livelihoods as well as on their socioeconomic status. And as I said, these self-help groups, it would be, I'm proud to say, they have been instrumental in bulk manufacturing of face masks and hand sanitizers and in spreading awareness even during the COVID-induced lockdowns. I did not show any presentation today, but we have got so many slides and we have shown to in so many forums that the way these self-help groups, these females, women across these districts had come up with the best practices of manufacturing face masks and hand sanitizers, and in no time, I mean, during the first lockdown, within a week, within 2 weeks, they had come up with lakhs of face masks. So, and as part of this aspirational districts program, I'm extremely proud to state that our program offers a very distinct and innovative channel to utilize this development assistance of Japan in impact ways. So it is directly making a huge impact in the lives of most underprivileged Indian citizens. Going by the SDGs commitment of leaving no one behind. And at our current pace of collaboration, I'm very positive that that India-Japan economic relationship is all set to achieve very new heights in the years to come. And at the same time, it will also help India inch closer to its SDG targets and its commitments to social justice. So with these words, I would close my remarks and thank you.
Thank you, Sumitra-ji. Matsumoto-san, thank you so much, Sumitra-ji. Very insightful, talk in spite of not giving a presentation. It's so much Niti Aayog is doing. We'll be highly obliged, if we can come, on a different forum to our college and, address our students. It's a very
Certainly, definitely.
Definitely, sir. Thank you so much. Matsumoto-san, Matsumoto-san, can we have a quick question and answer round? I know it is 11:30.
Yes, please proceed. Yeah.
Okay, sir, can you?
I have only one question which so many people from the academia across the country have asked, and that is, of course, they're highly impressed with what JICA is doing and how Japan is supporting SDG cause in India, and with Yakult and all the other sanitation and health hygiene measures taken by all the people who made the presentation here. That's very remarkable. They just want to know at what exactly the Indian student should be studying at the campuses to get into your company, to get into your jobs. That is one question they're very keenly asking for.
Yes, thank you very much for a good question. Yeah, and we really hope that the many students who are listening to today's webinar interested in working with the Japanese company. And now in India, more than 1,400 Japanese companies are working. And some of them are working in the manufacturing sector, maybe like Suzuki, Honda, Toyota. And also the other one working in the service sector, including like IT industry. Yeah, and we JICA is a government agency, so we try to facilitate the activities of the such kind of Japanese companies. Say like we are working with the state government to promote the more good environment of the doing business. Yeah, and they try to maybe change the policy, and they try to support the activities, not only the Japanese company, but also maybe foreign countries. Yeah, and our fund is utilizing for the not only just supporting the physical infrastructure project, but also supporting some like vocational training of the students. Yeah, and we are not so the agent to facilitate the direct job, but we are in a position to support such kind of like effort of the Indian students who are interested in working with the Japanese company. And we're also working with like IIT Hyderabad, for example, and they also hold the job seminar every year to invite many Indian companies or Indian, the students to introduce Japanese companies. So this is just also one occasion that the youth have a chance to work with the Japanese company. Thank you so much.
Thank you so much. That's sufficient for you to tell us that all the internships and projects, and obviously you have been seeing what exactly we or our students have been doing. Perhaps one of the first one to have more than 250 students studying your Japanese language. With your support, you've also recommended us for facilitator, resource person coming and teaching us from Japan at our campus. So I'm sure with your support, a lot of jobs would also generate for the students studying Japanese and taking Japanese at our Japanese center. Thank you so much for all the support and for your guidance to the students and the academia. Nikhil?
Yeah. All right. Thank you. One question, Matsumoto-san, for you. That see, in July, in an initiative taken to secure local supply chains and reduce dependency on China, Japanese government had decided to pay its company for moving factories out of China and back home. So, sir, in such case, if there are some Japanese organizations decide to move to India, what do you think, the institution like NDIM can play any role in hand-holding these Japanese companies to set up their base in India? How can we support such companies, sir?
Yeah, you are true that the Japanese government announced to support the Japanese company who tried to change their production base from China to other countries. And India is kind of like one of the attractive destination in this purpose. Yeah, and actually we know that several of the Japanese companies in China had the intention to come to India. Yeah, and like you know that one bottleneck, say, to promote this matter is that some of the situation in India sometimes not so matching with the demand of the Japanese side, such kind of like infrastructure development, and also some like attitude of the state government, and also some like legal issues and so on. Yeah, so this is not so small matter, big matter. So the Chamber of Commerce of Japan in India also working with the ministry in charge of this one. And so one of the maybe good input from your side about this matter is that firstly that you may suggest something to the government, how to maybe improve the situation. It means that how, say, easily the Japanese company can come to India. And so what is like demand of say, the Indian side, also the Japanese side, and what is the supply system and so on. This is one thing. And the second thing that, of course, the Japanese company would like to recruit the very, very excellent students. So you are like a very eminent institution that maybe you are also one of the good sending the institution of such an excellent students to Japanese company. So when say they can come here, that you can contact with them and maybe promote the job opportunity of your students. Thank you.
All right. Thank you, Matsumoto-san. Thank you so much. All right, sir. Sir, VM, sir.
One final question in case of a minute. What exactly Niti Aayog can support the academia and the students? How they can really actively support? We know there are hundreds and thousands of schemes. So the people listening to you today from various parts of the country, can you kindly suggest 2-3 straight-away things which they can venture upon and take benefit of your presence over here?
Sir, one very good thing about Niti Aayog is that they can join our program as an intern, sir. We have got very bright young professionals and very bright interns who are working with Niti Aayog, sir, also for the aspirational district program, sir. And some of them can also get associated with us for even while implementation of this program, sir. We have got our development partners, I should say, for example, Tata Trust, they have appointed around 70 aspirational district fellows. And these are very, very bright professionals, sir. They are passed out from, some of them from IIMs and IITs, and they are posted in 35 left-wing extremism districts, sir. So every district has got 2 fellows, and we have our CEO, sir, has even requested Tata Trust post to appoint aspirational district fellows for the remaining 77 districts. And because, sir, when we see a very significant difference between these districts where the aspirational district fellows are posted and in the other districts, vis-a-vis not the progress, sir, but vis-a-vis whenever any meeting is held or when we want to, we are also implementing very theme-wise projects, sir, in some of the aspirational districts. So, for example, for anemia, we are doing something very special. For for containing the water contamination in selected aspiration district, what we can do over and above the scheme. So there these aspiration district fellows are very, very instrumental, and there are 70 such fellows. And as I said, sir, this program, as Honorable PM says, our CEO says, and we believe that this program is not of Niti Aayog, this is the program of the entire country. So the students can very well get associated with us, sir, and we'll find some way out to get them associated and to give them some role in the implementation of this program.
Oh, that's very, very encouraging. That's very encouraging. We would be after you. Professor Nikhil will be connecting with you very soon.
Sure, sir. Sure,
so
sir.
that real benefit, what you are planning to give and what students are wanting to have, we really benefit out of that, and we connect the gap. Thank you so very much.
Sure, sir. Sure, sir.
Thank you. And thank you so very much. Extremely kind of all of you, extremely grateful to each one of you for being with us. You've been very, very kind. Mr. Mandal, Mr. Matsumoto-san, Ms. Shimada, Ms. Mori, Mr. Sakata, you have been very kind, and I'm sure all the people across the country have picked up a lot of thread and learning from each one of you. And kindly stay connected in the coming weeks, in the coming months. You have a very long vision, you have a deep vision, you have deep friendship with the country. And with the Matsumoto-san, things have been very pleasant for our country, especially for our New Delhi Institute of Management, which has been very kindly supporting in a very big way. And I expect similar support from Yakult. I also expect similar support from all others present over here and all the people across the country working with the Japanese companies, working with the Japanese organizations. I've seen the bankers who are working at the Japanese desk who have registered and who are hearing the program. So I only request that we are providing you, in a way, a Japan academic and industry center where we want to connect all the academia of the country with all the industry that's already existing in India and that's coming from Japan to India. We want to play the pivotal role for the benefit of both the nations, for benefit of the students, academia, and the businesses. We love to be doing it, and I'm extremely grateful to each one of you for your very, very kind continuing support over the years. Extremely grateful. Thank you so very, very much.
Thank you, sir. Thank you, sir.
Thank you.
Yeah, thank you very much.
Thank you.